Hi there. Sorry to disturb you while you're resting. My name is V. I'm a medical intern here at the hospital, and I have on your forms that you agreed to be a part of the learning process if need be. Okay, good. So I'm here to just conduct some very minimal regular tests to practice, and I just wanted to get your further consent to make sure that you're okay with that. Okay, good. Thank you. Just gonna write that down. You've got your consent here. You already filled out the form, but I just needed that verbal confirmation. Were you sleeping? Okay, sorry to wake you up. This shouldn't take too long, but I do have a few tests. They're non-invasive to do. Okay. Well, it's nice to meet you. Yes, okay. So first I'll just fill out all the information about who you are, okay? So, what's your name? Okay. And what is your reason for being in the hospital today? Okay. Not great. I mean, no one wants to be in the hospital, right? But I'm glad that it's not something that'll keep you in here for a long time. When did you break your arm? Gotcha. Yeah. I mean, there's always risks to skydiving, right? But you never expect that to happen. Okay. And can you just tell me your age and date of birth? Great. Great. And is this your first time in the hospital? Okay. Perfect. And when was the last time the nurses came to check on you? Okay, so they did fill out that form pretty thoroughly. I checked out your chart, but there are a lot of abbreviations I haven't learned yet, so a lot of it still doesn't make a ton of sense to me, but you know. And are you on any medication, Oh, yeah, okay, yeah, that makes sense. So there's not a ton of pain now. Good. And what was your last conversation with the nurse like? What did they tell you? Gotcha. Okay. So you're out tomorrow? That's great. Alright, well, first I'm gonna start by taking, most of these are just gonna be taking vitals actually, but I'm gonna start by attempting to find your heart rate and take your heart rate down, okay? Okay, so they like us to use the neck. I'm gonna see if I can find it on this side here with just my two fingers. I'm gonna press down on an artery. Okay, I couldn't quite get it there. Let me try the other side. No. You are alive, right? Just kidding. Okay. I'm sorry, would you mind just staying quiet for a second? I have to concentrate. Oh shoot, I forgot to look at the time. I was so focused on counting the beats. Okay, I'm gonna do it this time. And go. And then to get the full minute, I multiply that by 4. Okay, so that's your heart rate. Thank you. Sorry, that took a second. Okay, now I'm going to listen to your heart and also listen to your lungs to see if I hear any abnormalities like crackling or anything like that. So first, I'm just going to listen to your heart and make sure it sounds like a normal heartbeat, no murmurs or any skipping or anything like that. So I'm just going to place this right here. Good, and just breathe normally for a second. Oh, is that normal? I'm going to move to a different spot and just see if it sounds like that over on this side. Okay, I think that's just how your heart sounds. Okay, great. So now I'm going to listen to your lungs. I'm just going to place this right here. And could you just take a deep breath in and out? Okay, and I'm going to move it here. And take a deep breath in and out. Okay. And here, take a deep breath in and out. Good. And a couple around back. So take a deep breath in and out. Okay. And moving it. And in and out. Good. Okay. Just make a note there. Everything sounded normal to me, but I am a medical intern, so I'll run it by my supervisor. Okay. And then I'm going to listen to your stomach to make sure that your stomach is correctly making sounds. Yeah, okay, so I'm just going to place this right here. Is that okay? Good. And now I just need to listen to your intestinal gurgles. Okay. Sounds like a stomach to me, so great, I guess. Check and check and check. Okay. Now I need to do, I think, oh, your blood pressure. That's right, your blood pressure. So I'm just going to wrap this cuff around your arm here. Okay, is that comfortable? Good. So it's just going to get quite snug. If you've had your blood pressure taken before, you know it just starts to squeeze. And could you actually uncross your legs for me? Good. Thank you. Yeah, that does disrupt things somehow. I'm supposed to tell you to uncross your legs. We haven't learned that part yet. Okay, so just go ahead and relax as best as you can. And just take your blood pressure. And okay, and it'll just slowly release. Okay. Perfect. Oh, sorry, let me just take that off of you. Won't leave it on. That's embarrassing. Okay. So blood pressure was over 80. Luckily, there's less math to do there. It just tells me, so that's pretty simple. Okay. So let me grab pen light. I'm just gonna look in your mouth. Does anything feel uncomfortable in your mouth? Did you do any biting down in your cheeks or anything when you fell? Okay, just so I know what I'm looking at when I go in there. So go ahead and say ah. And this light is going to be bright, but I'm just going to be shining it in your mouth. Okay. Interesting. Okay, so there isn't a whole lot of redness or anything. Oh, did you get your tonsils removed? Well, yeah, not today, but just in life. Ah, okay. Cool. And go ahead and stick out your tongue. Just good. Everything's looking pretty normal there, I think, as far as I know. I don't see anything that is confusing. It just looks like the inside of a mouth. Great. I'll call that good then. Check, and check. But I'll just take note of the tonsils in case that's a part of my test. How old were you when you got your tonsils removed? Oh, just adenoids. Okay. Okay. I guess let's look at your ears. Yeah, let's look at your ears. Why not? Alright. So I'm just going to take my otoscope and place it inside your ear and just take a look. I know that your arm doesn't really have a whole lot to do with your ears, but I'm just going down my checklist here. Okay, so I'm just going to take a look inside of your ear here. Okay. Just taking a look inside your ear. Okay. Not seeing anything that looks strange. You have a little excess wax, but that's pretty common. And any tenderness as I poke around. Okay. Okay. And I'm just going to take a look on the outside of your ear with a brighter light. So let me just take a look back here. Just at the furrows of your ear. Okay. Just making note. Good. Just take a look around inside this ear. Less wax in this ear for some reason, which again I think pretty normal. I think sometimes our ears do different things, you know. They have their own ear personalities, maybe. Any discomfort here? Oh, sorry. Okay. Okay. And again, I'll just take a brighter light and take a look at the furrow of your ear. This part. Okay. Ears seem to be pretty normal. Good for you. Have you ever had an ear infection? They're so uncomfortable, right? Yeah. Okay. Now, I'm going to take a look at your eyes. So, with a different otoscope head, just going to take a look in your eyes, okay? Can you see the light here? Okay. Just looking at the light there. I'm just gonna take a look in your eyes. Okay. Just looking for your pupil reactions right now. And also just seeing if there are any surface markings that are unique or different that I haven't seen yet. I feel like I need more light. So I'm going to remove that piece. This might be a bit brighter. Okay. Interesting. Okay. Okay. Now, on my list of things, I do need to complete an eye swing test. So I'm just going to ask you to look at my finger here. And could you just follow my finger with just your eyes and try not to move your head? Okay. And this side. Oh, wait, I think the swing test is with the light. Yeah, it's the H with the finger. Okay, sorry, this should be with the light. Okay, so I'm just gonna swing the light in and out, and in, and out, and in, and out. Good. And the other side. In, and out, and in, and out, and in, and out, and in. Good. And now, with my fingers, I need to do the H test. So again, just follow my finger just with your eyes, and I kind of move it in an H sort of shape to make sure your eyes aren't wavering or doing any strange movements that aren't normal or might suggest some sort of brain injury. Okay. Perfect. That all seemed pretty normal to me. Okay. Now I'm going to use a brighter light and really see if I can see the back of your eyeball. So I'm just going to use this as a magnifying glass, but the light is going to be brighter. Just want to see if I can see the back, like inside your pupils. This one's a hard one for me. Oh wait, I think I see. Oh, okay. I think I see it because they show you pictures, but it's another thing to see it in person. Okay. Well, you're the first person that I've actually been able to see that on. Saw that. Check. Saw that. And that. Okay. Now I think I just need to check your reflexes and then I'll let you rest, okay? Okay. I'm gonna snap in your eyes. Sorry about that. I just needed to make sure that you react to objects coming towards your eyes, which you do. Okay, now I'm going to take, I think, your hand reflexes. I'm just going to press on your wrist, okay? So go ahead and give me your hand. And I'm just going to press. Good. And that does the correct on that side. And this hand, please. You know what? I'm not going to do that hand since that's the broken arm. I don't want to mess anything up. So just, yeah, go ahead and just leave it there. Since the pins and everything, I don't want to mess with that. Let's just do your kneecaps real quickly because those are the ones I know. Okay. So just let your legs be relaxed. Okay. And I'm going to try that one more time. Good. And this side. Sorry, I'm still learning exactly where to hit, so yeah, that was better. Knees and eyes did the thing. Okay, I think that's everything I needed for my little examination of your vitals, so thank you so much for letting me take the time, and maybe I'll see you around when I'm a real doctor, but I know you probably don't want to be around health professionals because that means there's probably something going on. But have a good one, okay? And get some rest, and hopefully nobody else will disturb you while you're trying to sleep. Okay, bye.